Alberta Premier Jason Kenney now publicly admitting his province has entered the third wave. According to Kenney, the fault lies primarily with people who continue to socialize despite public health restrictions on that socialization. Laura McQuillan is here with the latest.
Yesterday, Alberta was reporting its highest number of daily new cases since around mid-January. We're now into April, and that is something that's got them pretty worried. We heard that message from Jason Kenney, and he was responding to this, saying for the first time, it's a third wave. You can see it on that graph rising on the right-hand side. And a big concern there is what's going on with variants, especially that B117 variant that originated in the UK, now accounting for a third of cases in Alberta. And Jason Kenney yesterday saying that 2 weeks from now, the modelling in Alberta suggests that some 500 people will be in hospital with COVID, many of them with variant-related cases. 2 weeks beyond that, it could be 1,000, and it just goes up and up from there if people do not follow the rules. And when it comes to rules, he's focusing a lot on socialising heading into this long weekend, saying that people cannot get together with their family and friends. They need to stick with the people they live with. In Alberta, indoor gatherings are banned. You can get together with 10 people outdoors, and he's urging people to follow those rules or potentially face consequences.
We are now in a significant new wave of COVID-19. How bad that wave will be is up to all of us. Many Albertans, understandably, have just tuned out, believing that the vaccines and the weather mean we can go back to our pre-COVID lives. How I wish that were true. But here's the blunt reality that we simply cannot wish away right now. In the race between vaccines and variants of COVID-19, the variants are winning.
And of course, vaccinations some time away for most of the public. The message from Jason Kenney, though, no plans to put new restrictions in place. He said people already aren't obeying the ones they have. He doesn't think they would obey even further measures, but he is just reminding the public in Alberta to stick to what those rules are. No indoor gatherings this weekend, John.
Laura, we're also hearing growing concern about how the variants are impacting children. What's the situation there?
Yeah, this is something that we're hearing a lot of concern about in Alberta, with infectious disease specialists seeing that these rising numbers of children ending up in hospitals and in intensive care seem to be linked to variant-related cases. We'll show you how the numbers are looking at this point in time. So, in terms of active cases, about 8,600 in Alberta at the moment. More than a quarter of those involve children and teenagers, people under 19 years old. You see that hospitalisation number. Now, that was about 37 back in November. As of this week, 175. Causing a great deal of concern, not just in Alberta, but across the country. And on that point, we spoke with Dr. Matthew Alton. He is an infectious disease specialist in Montreal. And what he told us is, you look at those numbers for hospitalisations, intensive care admissions, it's horrifying for those kids and for their parents right now, but he is also worried about what's going to happen long term.
Let's not forget that critical illness of any kind can have profound effects, not just immediately, but long term, and especially for when we're talking about children, we're talking about developmental effects. And of course, there's also the issue of the long-haul COVID symptoms that may come into play. And this is really setting us up for a prolonged pressure on not only those children and their children's families, but also on the healthcare system in dealing with all these consequences.
So, concern in Alberta about that, but it's not specific to Alberta, John. Kids right across the country at just as much risk. Schools are open, kids won't be getting vaccinated for a while to come. And so the message being that if people can keep themselves, keep each other safe, then it will pay off for everyone.